This was a trial that was done at MD Anderson, a single-arm phase 2 study investigating the safety and efficacy of Ibrutinib in patients with previously untreated smoldering high-risk mantle cell lymphoma. These patients were defined as having a diagnosis of mantle cell lymphoma with the absence of B symptoms or other indications for therapy, and overall a low burden of disease is defined as less than 5 centimeters in terms of lymph node size, or less than 20 centimeters for spleen size, and lower white blood cell count of less than 30. High-risk features that were considered included TP53 mutational status, Ki67 of 15 to 30%, as well as multiple somatic mutation on next-generation sequencing, among others. The patients were enrolled and started on Ibrutinib 560 milligrams once daily. We enrolled a total of 20 patients on this study, of which 18 were evaluable, as 2 dropped out before the first treatment response assessment. All patients achieved a response, with about half achieving a complete response and the other half a partial response, using both PET, CT, and bone marrow confirmatory at the end of treatment for confirmation of response. Looking at just PET-based response, all patients responded, with all but 1 achieving a complete response. Approximately 8 patients came off study. The most common reasons for coming off study were actually toxicities in 7 out of the 8 patients. There was 1 patient who experienced disease progression and had cessation of the Ibrutinib. The other reasons, the most common was atrial fibrillation, which occurred in 3 patients, including 1 grade 3 event. And there were other secondary malignancies that were diagnosed, including 1 lung cancer and another tenosynovial tumor, leading to discontinuation. At this point in time, with those remaining on study, the 12 patients, those continued to be in complete response and have completed approximately 2 years of treatment on average. The next steps following our study, the phase 2 study investigating Ibrutinib in smoldering mantle cell lymphoma, would be really to investigate newer BTK inhibitors with or without anti-CD20 targeted therapy in this setting. There was 1 prior study investigating Ibrutinib and rituximab done out of Spain that had very comparable results to our study, suggesting that perhaps an added anti-CD20 monoclonal may not necessarily be necessary in these lower risk patients overall. There is a study that's ongoing out of the UK called the ZEBRA study, looking at zanubrutinib in combination with an anti-CD20 monoclonal antibody and trying to truncate the course of therapy to a shorter time frame.